So now let's talk about post-splenectomy findings. So these are highly tested questions in the exam, all right? They will love to ask you about post-splenectomy finding in the exam. So let's look at the post-splenectomy findings in the peripheral blood smear. So the first high yield finding is the Howell-Jolly bodies. So Howell-Jolly bodies are nothing but RBCs which contains the nuclear remnant. So normally RBCs don't have any nuclear remnant, but when they are present, they are called Howell-Jolly bodies. So normally spleen clears any RBCs with the nuclear remnant, but after splenectomy, this function is impaired. So you'll see RBCs with nuclear remnant or the Howell-Jolly bodies in the peripheral smear after the spleen is removed. So this is Howell-Jolly body. All right, this is an RBC with a nuclear remnant. All right, another high yield cell that you'll see in peripheral blood smear is the target cell. So target cells are RBCs which look like this. All right, so this looks like a target sign. That's why they are called target cells. So they are nothing but RBCs which have mismatched RBC volume and surface area. All right, normally target cells, when they form, they are removed by the spleen. But like I said earlier, after the spleen is removed, this clearance function of the spleen is not present, right? We don't have that feature. Then target cells and Howell-Jolly bodies, they appear in the peripheral blood smear. Super high yield from exam point of view. Now, another finding in peripheral blood smear is thrombocytosis. Now, you might be wondering why there'll be thrombocytosis. It's because of loss of function of storage, all right? Spleen normally stores a lot of thrombocytes and B cells and T cells, all right? When this sequestration feature of the spleen is gone, you'll see thrombocytosis, all right? Because there's no sequestration of the thrombocytes in the spleen. Another feature is lymphocytosis. Again, this occurs because of loss of sequestration. Now, you might be wondering, earlier I told there is loss of large pool of B cell, but here I'm saying there'll be lymphocytosis. You need to understand that this loss of large pool of B cell is loss of large pool of active B cells. In the blood, you don't have active B cells. They are mature B cells, but they are not active. The activation occurs in the spleen, all right? When this loss of active B cells occur, there is decreased IgM production, all right? So remember, it's the follicles where activation, proliferation of the B cells occur, right? And without spleen, this follicle is lost. So that loss, that loss of large pool of B cell means the loss of active B cells, all right? So you need to understand that. So now let's talk about vaccination, all right? And this is vaccination against the encapsulated organism when you're undergoing splenectomy. So if this is an emergency splenectomy, you do this vaccination after the splenectomy, all right? So post splenectomy. But if it's an elective splenectomy, let's say for sickle cell disease, or let's say for thalassemia, then you need to give this vaccines 2 weeks before the splenectomy, all right? So you give vaccination against the encapsulated organism. Like I said earlier, encapsulated organisms are destroyed by opsonization and phagocytosis. Without spleen, there's decreased IgM production and there'll be decreased opsonin, all right? So there's a risk of encapsulated organism infection. So you need vaccinations against strep pneumo, all right? So you administer pneumococcal vaccine against strep pneumonia. Then against Neisseria meningitis, you need meningococcal vaccine. And for Haemophilus influenza type B, you need the vaccine against it. All right. So these three are the most important vaccination for encapsulated organism. And this is super high yield from exam point of view. Now let's do some USMLE-style questions. So let's look at this first question. So a 32-year-old man is admitted to ICU due to sepsis. His past medical history is significant for a motor vehicle accident 4 years ago, for which emergency laparotomy was done due to internal bleeding. All right, so there was a ruptured organ and he needed emergency laparotomy. Since then, he has had multiple episodes of infection due to streptococcus pneumoniae. Currently, he's in sepsis and his blood pressure is 80/40, so he's in shock. There's tachycardia, and the blood culture obtained on admission grew streptococcus pneumoniae. So he has had recurrent strep pneumo infection, and again there's streptococcus pneumoniae isolated in the blood. All right. Impairment of which of the following mechanism most likely contributed to this recurrent infection? Now you need to understand that the patient probably had splenectomy. All right. So there was internal bleeding because of ruptured organ. Since then, there is recurrent encapsulated organism infection. So most likely there was splenectomy. So what function was impaired after splenectomy? So let's look at the options. Is it decreased complement production or impaired T cell activation, decreased opsonization, or decreased interferon release? Now, you might be confused with option A and C because I said complements are needed for opsonization, especially C3b. So you might be confused with decreased complement production, but you need to understand that complements are produced in the liver. The activation needs IgM. All right. So antigen antibody triggers the activation of complements, but they are produced in the liver. So option A is wrong. Now, decreased opsonization. All right. This is the answer. And we just talked about it. All right. Without spleen, the active B cells are decreased and there'll be decreased production of IgM, without which there won't be activation of complements and there won't be C3b, which is one of the most important opsonins beside IgG. All right, so the right answer is decreased opsonization is causing recurrent encapsulated organism infection in this patient. All right, so now let's look at another question. A 22-year-old man comes to your office because of 5-week history of cough, weight loss, fever, and night sweats. Now, he migrated from Nepal 8 months ago. His temperature is 100.5. Physical examination shows a thinly built man with enlargement of right supraclavicular lymph node. Chest and abdominal examination are normal. However, PPD test is positive. Biopsy specimen of the supraclavicular lymph node is most likely to show causative bacteria in which of the following lymph node locations? So if you remember what I taught earlier, tuberculosis causes involvement of the macrophage. All right, macrophages engulf the mycobacterium. So you need to understand which of the following location has excessive macrophages. All right. So let's look at the option. Is it the primary follicle? No, right? Follicles, they contain B cells. Is it the paracortex? Paracortex contains T cells. Now, the right answer is medullary sinus because if you remember, medullary sinus houses macrophages. All right. So the right answer is medullary sinus. Thank you. Hope you enjoyed the video.